A very warm welcome to all our listeners. It is not very long ago that India was praised for how it handled the pandemic and how quickly life went back to normalcy in India. In February 2021, the ruling party government declared a victory over pandemic, but didn't realize that it was too early to celebrate. And very soon the election rallies happened, and so did the Kumbh Mela. Call it the irresponsibility of the government or the irresponsibility of the citizens. Kumbh Mela was a disaster, and so were the election rallies. A population of 1.366 billion and a density of around 382 people per square kilometer, we decided to hold election rallies and Kumbh Melas. On one hand, we had the government which declared a victory on the pandemic a little too soon, and on the other hand, we had celebrities who opted to go on a vacation and distribute their vacation pictures to various social media platforms. Common people of India were doused with the confusion created by the government and their favorite movie stars. This, along with the pandemic fatigue, resulted in ignoring a lot of safety precautions. A combination of all such behavior led to the skyrocketing of cases and also an increase in mortality rate. The country very soon realized that its healthcare system is in a very bad shape. Very soon, hospitals ran out of oxygen, beds, and the necessary equipment to save lives. But why did the Indian government ignore the lessons learned during the first pandemic wave? Even before the vaccination was given to majority of Indian population, Indian government decided to export it to other countries. Was that a misstep? And why are the governments running from pillar to post for basic medical needs such as oxygen and ventilators? Can this be attributed to the miscoordination of state and central governments? Why did the government not calculate the influx of population for Kumbh Mela? Why was such a huge gathering even allowed? Not just Kumbh Mela, many festivals were celebrated across India and all social distancing protocols were ignored. During the first wave of pandemic, all of us decided to clap and honor the medical heroes among us. But are we slapping them today by ignoring all the social distancing protocols and by not wearing masks? The data models generated by various universities around the world predict that India might see on an average of about 500,000 cases per day with around 3,000 deaths per day. All such models and all the data is readily available for anyone to see on the internet. But why is the government acting so blind towards these numbers? Many state governments are not doing anything much except a nighttime curfew. Let's go back to the first wave of this pandemic. During that time, there was a WhatsApp message about how China built 2 big hospitals in a city called Wuhan. This WhatsApp message was widely shared, and I am sure many of you would have read and shared it too. Well, many of us praised China for its workmanship, but only few among us questioned why did the Chinese government build 2 big hospitals at war footing in a city with around 11 million population. Very soon, the neighboring countries like Singapore and South Korea realized the problem ahead of them. Even before the rest of the world realized the problem, South Korea was ready with its testing and also contact tracing technologies. On the other hand, Indian government spent the initial precious time on welcoming Mr. Donald Trump. It is only because of the discipline among Indians that we could overcome the first wave of pandemic with minimal damage. Very soon the virus quietened, and for us life started going back to normal. But for the government of India, it was also the time to worry and fill their vote banks. Very soon election rallies started happening across the country. The bullet train that we all dodged and the train that left the station long back reverted its path, and we all were pushed in front of it. Kumbh Mela was the final push for all of us. The recklessness of the Indian government and also the irresponsibility of some of us is causing a huge stress on already collapsing healthcare system. Viruses not only spread but also mutate. Every new host body is an opportunity for the virus to create a variant. The vaccines produced by various countries across the world work very well for the initial Wuhan virus. These vaccines work very well with the spike protein of the initial Wuhan virus. The efficacy of these vaccines on the new variants is still a matter of study. The double variant, the triple variant, the Bengal variant, the UK variant, and also the African variant. All the variants have started spreading across India. No doctor or researcher can tell you the efficacy of these vaccines on all the variants, but these vaccines might reduce the mortality rate and also the duration of the infection in the host body. That is the reason why doctors across the world are urging the people to maintain all the safety precautions even after getting vaccinated. In the history of human evolution, COVID-19 is a novel virus. This virus is very much under study. Every host body is an opportunity to create a new variant. Right from the Wuhan variant till today, there are lakhs of new variants already under study. As the virus spreads further and further, the mutations might result in a very strong variant or a weakened variant. From what we are seeing right now, we are progressing in a wrong direction. Also, India might see the highest spike in daily infections by mid-May. This spike and the suffering that this spike might cause can only be mitigated by a combination of efforts from the government and the people of India. It is very important for the common people of India to realize that following the safety precautions is of utmost importance. Not only is our healthcare system crumbling, but our doctors are heavily stressed. It is very important to realize that our healthcare workers are equal to gods for us, and it is our responsibility to protect them by protecting ourselves from the virus. The season of weddings is about to start in India, and also a lineup of festivals. Just for this 1 year, let's keep our celebrations within our family members so that we can celebrate on a very grand scale when we all overcome the second wave of pandemic. Along with clapping for our frontline workers, let's also support them and protect them by protecting ourselves. Allow me to quote an Indian old saying, Vaidyo Narayana, which means our doctor is equal to the Almighty. On that thought, this is Maha Telugu Podcasts signing off for today. I'll meet you soon. Till then, stay safe and stay happy. Thank you.